Welcome to the podcast, which today I'm presenting inside our education centre on the Stepping Hill site. And the room I'm actually in is the video conferencing suite. This is regularly used by our cancer teams to video conference across our partner organisations, taking forward the care that our cancer patients need. So I'm really proud to be here undertaking the podcast for you today. Unfortunately, we are still struggling with our accident and emergency 4-hour standard, and winter hasn't actually diminished. We've got a high number still of very complex patients, and when they are then admitted, the care package that often has to be put in place to allow discharge is very sophisticated. That means that patient flow is complicated to manage through. We're also still looking to recruit staff, mainly accident and emergency consultants, and again we'd be very interested in hearing from anybody who is interested in a position within the accident and emergency department, or indeed a clinical post somewhere else in the Trust. The Trust has got a significant financial challenge, and whilst that is not unique amongst other Trust organisations, it is something that we are as a board very concerned about, and a massive focus is being put by the managers and clinical teams to eradicate a £17 million cost improvement programme. We've got a programme called Building a Sustainable Future, which is about how we're going to transform the organisation in the next 3 years into delivering a more sustainable, leaner, meaner, tighter ship for providing the very best quality of care to our patients and their families. And so it's something that every single member of our staff is either already very involved in or will be involved in. I have recently appointed a turnaround director to help facilitate the changes that we need to. His name is Phil Church, and again he will be meeting most of our staff and many of our stakeholders in taking forward what is bound to be a significant, a challenging, but hopefully a fruitful programme to deliver our cost improvement. We've recently had the results of our Care Quality Commission inpatient survey, and generally from the 70 questions that are asked, we are similar to most other hospitals. However, there were 5 where we were faring worse, and we're looking very carefully at those, as well as the other areas that we believe we can improve upon. The main areas of concern remained information to patients and noise at night, but I'm pleased to say that both of those, which did come up last year, are absolutely on track in terms of initiatives. However, clearly we haven't moved fast enough and we need to improve in those areas. One of the things that we've done is we've implemented a new scheme whereby we're undertaking mini CQC, Care Quality Commission, visits ourselves. So internally we're actually visiting areas, and that's involving executive and non-executive directors from the board of directors, along with other senior managers and nurses, to visit areas, tell them how they fare against the CQC standards, and implement action plans where those are necessary. Those have just begun, and I have to say that so far it's been really commendable, the work that's being undertaken in our clinical areas. There are some places where we could improve, but we're on board with those almost immediately. As part of our drive for transparency and openness, the board has agreed that in line with the Mid-Staffordshire inquiry, we will commit to providing information on our staffing levels in our wards. Each of our ward areas have got new boards being erected outside and inside of the wards, giving information on nursing indicators, clinical standards, outcomes, and in particular the planned nurse staffing levels and the actual nurse staffing levels. So those go live in the next few weeks in an effort to show people exactly where we are in terms of our staffing complement. And finally, I'm really pleased to be able to welcome 3 brand new people helping the Trust. They are our youth ambassadors, and they have been picked by younger members of the Trust organisation only, and 55 different people put their names forward with a portfolio of the areas they would be able to help us in. 3 were successful. We're very much hoping that some of the others will also be able to help us in tasks taken forward to make our organisation the right sort of place for young people. Young people don't need the same kind of things, don't want the same kind of things as either the very young or older people, and so it's really important that we have them involved. The first 2 areas they're going to be looking at is how we can make our website seem attractive to younger people. And then there's our Open Day, which is coming up, and they will be heavily involved in that to encourage still further involvement. Interestingly, this new initiative of ours, which is yet fully tested, has already shown great interest, and other trust organisations and organisations involved in governance of foundation trusts have asked us for information about what we're doing. So well done to the comms team for supporting the membership department and for supporting those governors who are involved in membership in taking forward this fantastic new initiative.